Hi guys, welcome to my channel. I'm Dr. PKJ, and in this video we are discussing a clinical vignette which is based on a PARC three-step test, but it's kind of not a classical question. It's a modification of the PARC three-step test because the information provided is not complete to basically use the PARC test. So we are going to see how to solve questions like this. So basically I asked this question on my Telegram channel, and only around 40% of you got this right. 60% did not get this right. So we'll try to see how to solve questions like this. So the question was something like, a patient comes to us with a left head tilt. He gives history of diplopia which is increasing on going downstairs, and on examination the doctor notices a right hypertropia. So which is the most likely paralyzed muscle, right? So let's see how to solve questions like these. So basically in the last video I was discussing a question that was classic of PARC's test, and for PARC's test you need three pieces of information. You need a hypertropia, whether it's right or left. You need information whether the hypertropia is worse on right or left gaze or head turn, and you need information whether the hypertropia or diplopia is worse on right or left tilt. So you need direction of hypertropia, you need direction of the gaze in which it is worse, and the direction of the tilt in which it is worse. Now let's see what information we have been provided in this question, right? So here they're telling us that there is a right hypertropia, and they are telling us that there is a compensatory left head tilt, but instead of telling us about the gaze, they are saying that there is diplopia which increases on going downstairs. So even though the information may not seem complete, the diagram, the method of solving the question is the same using the edge diagram. So the first step is we make the edge diagram, correct? This is your right eye and your left eye, and the 8 positions of gaze in which the vertical muscles act, and I've labeled them correctly: superior rectus, inferior rectus, superior oblique, inferior oblique, inferior oblique, superior rectus, inferior rectus, superior oblique, right? So the first step is to get the edge diagram correct. Now let's process the information and highlight the correct group of muscles. So the first thing is that there is right hypertropia. So in right hypertropia, the depressors of the right eye can be paralytic, or the elevators of the left eye can be paralytic. So in this diagram we've got these two muscles, right? Superior oblique or inferior rectus, that can be paralytic, or inferior oblique and superior rectus, that can be paralytic, correct? The second point is that the diplopia is worse on depression. So which muscles depress the eyes? So the ones highlighted in green, right? Inferior rectus and superior oblique are the muscles that will depress your eye. So basically, if the patient is having diplopia which is more on going downstairs, which means when he's looking down, his diplopia is more, which means that the muscles that were supposed to be acting for depression are not acting correctly. Now the third point is that the patient has a left head tilt. What that means is that the patient is maintaining a left head tilt so that he does not experience diplopia, right? So if there was a right head tilt, his diplopia would be worse. Now remember, the PARC's test, we need information of in which direction is the diplopia worse, or in which direction the diplopia is more. That is what we need to graphically represent in the edge diagram, right? So this patient has a left head tilt, which means in left head tilt his diplopia is less and his diplopia is worse in right head tilt. So now understand what happens in a tilt. if there is a right tilt, in the right eye there is supposed to be an intorsion, and in the left eye there's supposed to be an extorsion, right? So if the diplopia is worse on a right tilt, that means that the right eye intorters and the left eye extorters are not working properly. Okay, so which one? On right tilt there is worsening of diplopia. That means that the intorters of the right eye and extorters of the left eye, intorters of the same side as the tilt and extorters of the opposite eye to the tilt, they are not working properly. Correct? I hope it's clear. So what are your right eye intorters? The intorters are basically SO and SR. These are the intorters. So in the right eye, superior oblique and superior rectus are paralytic if there is a worsening of the diplopia on right eye. So I have highlighted these two, superior rectus and superior oblique. Whereas on the left side, the extorters are paralytic. So I have highlighted inferior oblique and inferior rectus because those are the extorters of the eye, right? So this is a different edge diagram because normally in a Parkes test, you will get a triangle and you will get an angle. But in this case, what we are getting is something like this, right? We are getting a ZN. So don't worry about this. The answer will be the muscle which has been highlighted thrice, right? So if you can see in this diagram, superior rectus has been highlighted just once, inferior rectus has been highlighted twice, but superior rectus has been highlighted thrice, right? So the answer would be the right superior oblique in this case, correct? On the other hand, if you look at the left eye, superior oblique highlighted once, inferior rectus highlighted twice, inferior oblique highlighted twice, superior rectus highlighted twice, right? So if you just make this edge diagram and try to choose the correct muscles which obey each of the informational pieces that are given in the question, you will invariably get the correct answer. Correct? Just choose the correct muscles which obey all the information that has been provided in the question. That is the trick to solve questions like these. Now, so we got the answer as right superior oblique. We can use some information about SO palsy to confirm that this is the correct answer, right? So normally in an SO palsy, remember that the diplopia is better on opposite tilt and the diplopia is worse on opposite gaze. So remember the two mnemonics, boot and voog. In a SO palsy, the diplopia is going to be better on opposite tilt. So the patient is going to maintain an opposite tilt. So if the patient has a right SO palsy, he will keep a left head tilt, correct? So the question provides us with the information that the patient is having a left head tilt. So if there was a right SO palsy and left head tilt, those two match. So again, this is a mechanism to cross check. Once you arrive at the answer using the H diagram method, you can just use this mnemonic boot and voog to finalize your answer, right? To be sure that you're getting the correct answer. I hope this video was helpful and I hope you are able to understand and solve questions like these. If you have any comments, please leave them below, and also subscribe to this channel because I'm posting ophthalmology content frequently now. Thank you for watching.